My name is Maru Khawan, and in this video I will be talking about cancer screening programs. In this picture we can see skin cancer on a patient's face. So throughout this video we will be talking about different cancers and how they are treated. So what is cancer? Cancer is a disease caused by an uncontrolled division of abnormal cells in a part of the body. And in this picture we can see cells dividing uncontrollably, and so basically this is a cancer cell. Background information. So cancer is a disease which is spread worldwide that every year 7.6 people die because of cancer. And to treat and to prevent cancers, what we use is called cancer screening programs, which allows us to detect a mutation and treat it before the symptoms occur. Cancer screening programs have some benefits and drawbacks. There are various types of cancer screening programs for all the different types of cancer. Mammograms is used to treat breast cancer in women. So the benefits for mammograms is it helps us to detect the cancer at an early stage, and women aged 50 to 69 who take part in this screening program have a high chance for survival from breast cancer. Some drawbacks to mammograms is false positives, when the cancer is detected but other tests do not reveal the presence of cancer, and overdiagnosis, when the screening detects the cancer that would never have had any effect on the patient if there was no screening done. Colonoscopy is another treatment which is used to treat colorectal cancer. Some benefits to colonoscopy is it not only detects colorectal cancer, also helps to find any gastrointestinal and bowel diseases. The screening also helps with the removal of polyps, tumors that grow inside the intestine and rectum. Drawbacks to colonoscopy is that it is an uncomfortable and invasive procedure where patients are put to sleep. This leads to them having a day or two skip from work. The preparation for the screening requires the patient to be on a certain diet and laxatives a day before. Also, the screening comes with several complications such as bleeding and death. So basically, it is a big risk. So this picture shows the procedure of colonoscopy. Over here in the doctor's hand is a remote control, and the scope goes into the intestine and it is attached with a camera, so this which shows the path in the intestine, and on the computer screen in front of the doctor, that's where the doctor can determine any abnormalities. How is the procedure for cancer screenings performed? There are many different types of cancers, and each cancer can be treated by many different cancer screening programs. Breast cancer screening. Clinical breast exam. The doctor will carefully feel the breast and under the arms for lumps. If there is a lump, it could possibly be a tumor. It needs to be checked with a mammograph. Mammography. The breast is placed on a flat support plate and is compressed with a parallel plate called a paddle. An X-ray machine produces small bursts of X-rays that passes through the breast to a detector on the opposite side. Areas of low density such as fatty tissues appear translucent, but areas of dense tissues like connective tissue or tumors appear whiter on the black background. Magnetic resonance imaging, or MRI. The patient takes off all the clothes and the jewelry that they're wearing. They wear a gown made out of lead. The patient is put on a tiny slab and pushed into a hole in the machine where the patient lies still, and the machine scans your body. This procedure uses a magnet, radio waves, and a computer to collect the pictures of inside your body in detail. So this is a picture of mammograph. This plate right here is where you place your breast, and the X-rays check for abnormalities, and the doctor checks those on the computer screen right here. In this picture we can see the MRI machine. It is as big as a car, and this is the hole where the patient is pushed into, and the radio waves inside scans your body. Cervical cancer screening. For cervical cancer screening, doctors use Pap test. This test looks for abnormal cell changes in the cervix. An instrument called a speculum is gently inserted in the vagina. Cells can be taken from the cervix and are sent to a lab to be examined. Skin cancer screening. Doctors use skin exams to treat skin cancers, and if an area of the skin looks abnormal, a biopsy is usually done. The doctor will remove suspicious tissues with a local excision. A pathologist then looks at your tissue under a microscope to check for any cancer cells. So this is a picture of skin cancer, and this red patch is enlarged here, and we can see the different abnormalities in the cancer cell. So how does cancer screening affect the society? Many people suffer from cancer around the world. There are some people who can afford cancer screenings, but some people cannot, as they are affected with some very significant issues such as economical problems, cultural beliefs, and many more. Economical problems. In the past, many people feared to go to the doctor because of any disease being diagnosed, especially cancer, as they were not able to get their cancer treatment done because of limited financial resources. Working cancer patients do not get their treatment done as they are unable to get off from work because they worry about income loss or getting fired from work. But if children get sick, they will be taken to the doctor regardless of any financial or practical constraints. Cultural beliefs. Looking at the cultural side, many women are emotionally challenged, and so they fear to visit the doctor. They're responsible for their home and family, so they cannot afford any disease. If a woman is diagnosed with cancer and enters treatment, her role is changing from someone who gives care to someone who needs care. Different appointments and long treatments keep a woman from her established role in the family away. Men, on the other side, have little knowledge about cooking and other responsibilities towards home, but men who act as the head of the house are afraid that a diagnosis of cancer will make them appear weak to their family and will interfere in their ability to care for their family. If diagnosed with a serious illness, a man may hide his illness from his loved ones as long as possible. This may cause feelings of isolation, loneliness, and depression, and may affect the man's treatment and healing process. All these factors keep people away from visiting the doctor and getting any serious disease diagnosed, such as cancer. Especially working men and women are afraid, as they don't want to keep their family under a heavy and emotional burden and depression. Social, political, and ethical issues with cancer screenings. Cancer screening programs save several lives, but some conceivable harms must be taken into consideration against any benefits of cancer screenings. Social problems. Although most cancer screening tests are non-invasive, some screenings involve small risks of serious complications that may be critical. For example, perforation with colonoscopy. Another complication with the treatment can be delayed. For example, potential carcinogenesis from radiation. Another harm is the false positive test result, which can lead to anxiety and unnecessary diagnostic procedures. Political problems. Majority of the people around the world believe that cancer is a non-political issue. However, some people believe that cancer has always been an intense political issue. How? Well, a large part of cancer is the carcinogenic impact of pesticides, pollution, tobacco, and other chemicals. And how it becomes a political problem is that the government does not take any action against these factors. So political factors that may cause cancer is pollution, tobacco, and pesticides. Ethical problems. Patients can be intimidated into screenings by enthusiastic clinicians and through public campaigns. This results into stressed population more than an individual benefit. Even attentive clinicians can have difficulty establishing that patients do have a realistic view of the risks and benefits of screening so that they can provide a proper informed consent. Solutions. Everyone says that they want to fight cancer, while the following steps can reduce the incidence of cancer. Improve the treatments of cancer. The government should ban the illegal use of carcinogens, and the government should make sure that everyone has access to health insurance care so that cancer patients can afford the treatment. Statistics for cancer in Canada, Ontario, 2013. So basically, this is an overview of new cases and deaths in Ontario for 2013. So an estimate of 187,600 new cases for cancer will be diagnosed, and an estimate of 75,000 deaths from cancer will be this year. And top 4 newly diagnosed cancers are prostate cancer, lung cancer, breast cancer, and colorectal cancer. Cancer statistics for men in Ontario. Prostate cancer is the most commonly diagnosed cancer for men, and an estimate of 9,600 men will be diagnosed with prostate cancer. An estimate of 4,800 men will be diagnosed with colorectal cancer. An estimate of 4,400 men will be diagnosed with lung cancer. Lung cancer is the leading cause of cancer death for men. and an estimate of 3,600 men will die of lung cancer, an estimate of 1,850 men will die of colorectal cancer, and an estimate of 1,500 men will die of prostate cancer. Cancer statistics for women in Ontario. Breast cancer is the most commonly diagnosed cancer for women, and an estimate of 9,300 women will be diagnosed with breast cancer, an estimate of 4,200 women will be diagnosed with lung cancer, and an estimate of 3,900 women will be diagnosed with colorectal cancer. Lung cancer is the leading cause for cancer death in women, and an estimate of 3,300 women will die of lung cancer, an estimate of 1,950 women will die of breast cancer, an estimate of 1,500 women will die of colorectal cancer. So this pie chart shows the proportion of deaths due to cancer and other causes in Canada for 2007, and it clearly shows that cancer was the major reason why so many people died, and it was 29.6%, and then the rest, other diseases. In this pie chart, it shows the proportion for deaths due to cancer and other causes in Canada for 2009, and again, cancer was the main reason why so many people died, and then the rest, other diseases, come. This table shows Canada's top 10 causes of death, and it is for year 2000 and year 2007, and again, cancer has always been on the top. In 2000 it was 28.7% of the population who died, and then in 2007 it was 29.6% of the population who died because of cancer. So bibliography for APA format. So eat healthy, stay healthy, prevent yourself from cancer because prevention is better than cure.